Hi there, my name is Laura Burden, and I'm the founder of Burden Brand Management, a boutique social media marketing agency based in Vancouver, Canada. We specialize in social media marketing for health and wellness brands. Caldera Clinic is a client of ours. I'm here to speak to you today about social media and patient engagement. So, I've been working in social media marketing since 2013, and in this time, we've worked with a variety of lifestyle and wellness brands, including multiple clinics, to help them build a brand awareness, and as well as physicians who are looking to build a personal brand online. So our agenda for today, it's short and sweet. We're going to be talking about patient engagement. We're going to be talking about why you should be leveraging social media marketing. We're going to talk a little bit about how to get started in social media marketing and how to integrate it. And then we're going to go over some ideas and applications of social media for clinics that I've seen done really well. So let's start off with patient engagement and what this even means. So patient engagement is defined as a combination of a patient's knowledge, skills, ability, and willingness to manage their own health and care with interventions designed to increase activation and promote positive patient behavior. So it's a mouthful, but what does it even mean in this context? So in this context, we're going to be talking a little about using social media as the intervention that is designed to increase activation and promote positive patient behaviors. So let's talk a little bit about why social media is so important. And one of the questions I get asked all the time is social media even worth the hassle? And the answer is absolutely. So a really cool study that was done in 2018 showed that they were able to augment patient engagement and satisfaction through the use of online support communities. So basically what they did in this study was they created a Facebook group for liver transplant patients. And the idea behind this group was to be offering them a patient support community. And in this group, there was healthcare providers, there was patients and caregivers as well. So they surveyed the group members after 9 months, and they found that 95% of the survey respondents felt that joining the group had had a positive impact on their care. So this is obviously a very new study, but it shows that there's so much potential for social media to be used to help build patient support communities and to help build patient satisfaction, patient engagement, which is really exciting. Another great reason to be on social media is it helps to increase patient education and health literacy. People are so quick to turn to the internet for their health questions and concerns. Being able to put out really high quality content that addresses these questions and concerns can help to increase their patient education and their own literacy of their health. The next reason to be on social media is it helps to build the know, like, and trust factor, which basically states that all things being equal, people prefer to work with people that they already know, like, and trust. And a personal example of this was I found my dermatologist on Instagram. I'm sure there are so many, really lovely dermatologists in my city who are just as qualified, if not more. But I chose to go with the dermatologist that I felt like I knew because I'd seen them on Instagram. So Instagram, Facebook, any of these social media platforms are a really great way to build rapport and create those connections with patients. So let's talk a little bit about how you can get started on social media and how to integrate social media into your practice. So the first thing you want to do is consider what the right platforms are for your goals. So everyone's goals are a little bit different. Maybe your goals are to connect with other physicians. Maybe you want to connect with patients. Maybe you want to establish yourself as a thought leader. There is a platform that's almost perfect for any goal. So you really want to consider which platforms are going to help you reach those goals. Um, you also want to really consider where your audience is, where your ideal clients are, or your ideal patients, or whoever you're trying to connect with. Obviously, Facebook skews a little bit older. It's the 35 and above age group. Instagram is kind of 24 to 34. So you want to be taking that in consideration when you're choosing the platforms you want to be on. It's more important to do, one or two platforms really well than to be on all the platforms kind of half-heartedly. So that's something to take into consideration. You also want to consider what your objectives are for social media, and this is kind of what I touched on in the above. As you get started, what are your goals with social media? Are you trying to get more publications? Are you trying to get more patients in the door? Are you trying to connect with your current patients? This will inform your social strategy moving forward. And this is where you're going to develop your social media strategy. You want to talk about how often you're posting, and remaining consistent. And something I get asked a lot is what's the magic number for the number of posts per week? And there is no magic number, there's no right answer for everyone. The rule of thumb, though, is you want to post as much as you can without sacrificing the quality of what you're posting. So if you can do 3 posts really well a week, that's perfect. It's better to do 3 really great posts than to do 10 so-so ones. So quality over quantity for sure. You also want to be remaining consistent. If you commit to posting twice a week, then post twice a week. But there's nothing worse than, burning yourself out by posting 10 times in one week and then nothing for a week and then another 5 posts. It's really important to have a really regular and consistent posting cadence. So when it comes to creating content, you want to be creating content that speaks directly to your ideal audience member or patient. So this means using language that is approachable and understandable, no medical jargon unless you're trying to reach other physicians. This is a mistake I see happening all the time. Physicians, surgeons, they'll post a ton of content that's really quite intense, and they'll be confused that patients aren't engaging with it, that their phone's not ringing, because patients don't necessarily understand what you're talking about and it doesn't resonate with them. So just keeping that in mind. You also want to be aware of the questions that your patients are asking and what future patients are asking. So, taking note, keeping track of the questions your patients are asking, the questions they had in the past, and using those questions to create new content. Another really great way to integrate social media into your practice is to use video. So it's easier than ever to be using different formats of video. You don't need to have professional quality. There's so many options. There's YouTube, there's Instagram TV, Instagram Stories, Instagram Reels, Facebook Live, Instagram Live, TikTok. All of these are meant to be shot on your phone, maybe with the exception of YouTube, but the idea is that it's quick, it's easy, and it's meant to be very approachable and straightforward. And the great thing about this is you can use these videos to stand out, answer questions that you're getting, build rapport with your audience. A lot of people still aren't using video, and even less people are using video well. So if you're able to use video and you have a good presence and you're able to communicate information clearly, it's a really good opportunity to stand out. So social media is great for, getting traffic, but the more important thing is to be directing that traffic from social media to your website or a mailing list or somewhere else where you're furthering the relationship, whether that be to book a consult with you, to sign up for updates, to check out your blog. You do want to be using that traffic from social media and sending them somewhere else. So using social media as a way to build community, and this is something I touched on in the first example, but Facebook groups are a really great place to facilitate connections, share resources, and answer questions. And this can be done with future patients or current patients. But because of how the Instagram and Facebook algorithms have changed, Facebook is really focusing on building community, building connections. So content in Facebook groups ranks much higher than a promotional post. So that's something to keep in mind as well. So ideas and applications that I've seen done really well. So one of my clients is a plastic surgeon, and he's been doing patient interviews with patient involvement and consent, of course. So basically what he does is he interviews the patients before they go in for their surgery. They talk about the questions they had, they talk about the concerns they have, and then the next interview is them after the surgery. I think it's usually 2 to 3 weeks post-op for a follow-up interview. And same thing, ask them, how was your healing process? How did the surgery go? How are things progressing? And it's a really great way to have your patients speak to your future patients. It's a lot more relatable for them to hear from someone who's going through what they want to be going through, what they could be going through. It's way more relatable than hearing a surgeon talk about the technique they're going to use or what the surgery is like. Hearing directly from people in the same situation as them is way more meaningful. So that's a really cool application that I've seen used. Another idea that I've seen done well, and you have to be careful with this one, is sharing ongoing research and updates. So of course, this kind of ties into the earlier point I had about not using too much medical lingo or jargon. But you do want to show your patients that you put your finger on the pulse, you're at the forefront of what's coming out, the technology. the trends. So sharing that information in a way that's understandable and easy to digest. Then creating content that clears up common myths or addresses frequently asked questions. We've had a ton of success with this for a lot of our patients. And it's basically content or posts that to you seem so obvious. It's things you take for granted. This is usually the content that does the best because it's questions that people are asking, it's things people are curious about, or it's a myth that someone's already believing. And you're creating a piece of content that is just, a myth buster or addressing these questions. And the reason they do so well is people will often share these posts to their own stories, or they'll share it with a friend, or they'll share it on their feed. And that's a great way to get your content in front of more eyes that are relevant to your brand. So I want to take the opportunity to go over a couple different examples of the engagement that we are seeing on Facebook for one of our clients. So this is the Pelvic Awareness Project, and they are a partner. They are a partner of Caldera clinics. So basically, they are trying to create awareness about pelvic floor health. So this is on our Facebook page. I have a couple of different examples of comments here. So one lady is sharing that she's had 5 different surgeries for pelvic relief. She eventually discloses that that she's 80 years old. So I think that's really cool that we have someone that's of an advanced age. They're sharing their experience with pelvic health. They're sharing their experience with the surgery. And as you can see, there are 6 reactions there. So people are engaging with this content and engaging with each other. Here we had one follower ask a question, and then before we could get back to it, or I think we had gotten back to it further below, but another follower ended up sharing their own experience where she shares that she's had her 3rd surgery. That's the one that finally worked for her. So it's great to see this engagement happening where followers are answering each other's questions, they're engaging with each other. Here we have another example, same thing, someone leaves a comment and then this person asks them what can be done. And then here she shares her own experience about the specialized therapist that she's seeing. She shares that Medicare is paying for it and, providing her own experience. This is giving, this other lady hope for her own treatment. And then we've got a longer one here where they're talking about cranberry juice and the different options that they take, where they find it, which I think was awesome. The really cool part about this was that if you click through to each of these ladies' profiles, you'd see that they're completely different demographic, but it's great that they have connected online, they're sharing information with each other, and it's a really great online community. So obviously with social media, there's a lot to talk about. There's a lot of different applications. There's a lot of different ways to integrate it into your clinic. But I hope that this talk gave you a couple ideas and helped to inspire you to be utilizing social media for your own practice. Thank you so much, and I hope you all have a great day.